Vaccine is another vaccine we are going to take as a state initiative. We are already in touch with the Government of India, with Gavi, with UNICEF. But it takes some time. It takes some time to get it as a state initiative. And we would request Dr. Haldar if he could give us PCV vaccination very soon so that we have it under UIP, under the government program. Why we say this? Because normally Goa is doing very well as far as health sector is concerned. And it so happens that Government of India always keeps Goa in the subsequent phases. Because they have got other states, they have got other priority states, and Goa is kept at the side for the time being, where Goa is doing very well. But sir, I would like to tell you that Goa, we are having infant mortality rate at 8 to 9 in between for quite some time.
I think as far as Goa is concerned, I am using this platform actually just to appeal to our health officers that we are now over the next 3 years going to a little bit work in a very different way. Immunization is something that we have always given trust. And also Goa is, I would like to share with you that Goa is one of the only states, must have been the only states where we initially started immunization program and including injections like pentavalent and several other injections initially, I think a couple of years back. And only after that it came into the NHM, and then where funding was being given to the state. Actually we took it up as a pilot project. Goa is has been a very forward-thinking state, and also we have been trying to see how we can strengthen the immunization. Always what is to happen is the program of the state has to be very, very strong. And I think we were one of the few states that decided that we should give a thrust to providing this type of immunization program, because in order to avoid people going to the private sector. It is the duty of the government to ensure, and like you just mentioned, that it's a part of one of the schemes of the Prime Minister's flagship program. So this is integrated also with the WCD program. So as a result of which, I being the Minister for both Health and WCD, I think we will be able to coordinate this in a much better manner in the state of Goa. But I would like also, WHO, I have been also talking to several people, and I think in the middle we were trying to reach out to WHO on several other initiatives which we could indirectly. I think since you come on behalf of the Ministry of Family Welfare, I am myself going to meet the new minister who has taken charge, who is supposed to be very dynamic and supposed to be very well versed with the issues of healthcare and basically outreach programs. I think it is important that there are certain areas in India, especially if we have to see that we are able to have a very strong population and also see that the children at that age and that type of immunization program, and apart from the other outreach programs that to move forward, then it is important for organizations like WHO with the vast experience they have to give their input.
Video journalist Sanjay Munali from Panjim for HCN.